It may be happening. The GOP may be finding common ground around this health care bill. Two key Republican lawmakers, Fred Upton and Billy Long, throwing their support behind the party's health care overhaul today after crafting changes to provide $8 billion over 5 years to shore up coverage for people with pre-existing conditions. Physician and Congressman Michael Burgess, he also met today with President Trump, and he joins us now. Congressman, I know you had a long day. Thanks a lot for joining us.
Oh, absolutely.
I watched the press conference, and it felt like there was a sense of guarded optimism and also a sense of relief as well. But I wasn't sure if you are on board now, and if so, is it contingent upon the so-called Upton Amendment being part of the final bill?
Well, it's contingent upon the total package, and as you know, gosh, it's been a month ago that our committee marked up a bill. Took us 28 hours that night to come to a conclusion. Every Republican member of the Energy and Commerce Committee voted in favor of the Republican bill to repeal Obamacare. It went off to the Budget Committee and got stitched together with the Ways and Means portion that dealt with the tax pieces. And this was the bill that was supposed to come to the floor about a month ago. Now, unfortunately, that all got put on pause. I actually thought that was a mistake at the time. I thought it was a good bill. I thought it had done a good job as far as managing the competing constituencies that were concerned about things. In the intervening time, you've had people come forward with concepts like invisible risk pools. You've had people come forward with allowing states the flexibility to opt out of a mandate. And then today, most recently, you had the Upton-Long amendment that provided premium support for anyone who might be adversely affected by the state asking for a waiver out of the requirements in the insurance. So we're talking about a narrow segment of the population that might have been affected. It doesn't mean it's not important, and it doesn't mean that it's not people that we don't care about, but people in the individual market who allow their coverage to lapse, they don't maintain continuous coverage, who then get a tough medical diagnosis. There was concern if they were in one of the states that had opted out or one of the states that had requested a waiver, that they could be at risk for increased premiums. This Upton-Long amendment language now provides stability in buying down those premiums for those individuals, and I think that's a good step.
Well, and again, I feel the compassion and the medical doctor and all those things coming, but by the same token, Republicans have been very successful running against Obamacare and with a pledge of completely repealing it and going back to the drawing board. I feel like that's no longer going to happen at all. But
it is. And stop and think for just a moment. The $800 billion of entitlement reform that exists in the Medicaid portion of the bill that was done a month ago. I mean, that's huge. When have you heard us talk about $800 billion of entitlement reform? $1 trillion in tax relief that was done by the Ways and Means Committee. When's the last time we talked about $1 trillion in tax relief? And then, of course, the individual mandate, the employer mandate being removed. Those are really the central thesis of Obamacare was based upon the individual mandate. So these are very positive steps that have been taken by the Congress. Is it everything that people might have wanted at the outset when Obamacare was first passed? No, perhaps not, but this is a very good step. It's the key that gets us through the door for a lot of other things that can happen in the healthcare space. But we've got to get this done. We've got to get this over to the Senate. So everyone over in the Senate likes to tell us how much smarter they are than we are. I want them to have an opportunity to demonstrate that.
Okay, well, I think we all do, and I certainly will tell you, as an American, I appreciate all the effort that you've put into this, and you're meeting with the president today, and maybe we will cross this hurdle. Congressman Burgess, thank you very much.